once you've ruled out the bad stuff, here are the treatments for you. And I'm going to do these in order, okay? We've created something with our Concussion Fix program called the Concussion Recovery Pyramid. And it's all about building the foundational elements first. All right, a lot of people go right to the tip of the pyramid, which is kind of the rehab, more of some of the passive modalities. They try to go right there first, and unfortunately, it just doesn't work unless you build this foundation. So foundation element number 1 is work on mindset and your mood. Like I said, depression is associated with fatigue. Anxiety, stress causes this imbalance in default mode interference, right? So you're using both brain networks. So you need to find ways to reduce your anxiety, reduce the activation of your default mode network, become more present in what you're doing. Mindfulness, cognitive behavioral therapy, socialization, building relationships, finding a purpose, something to do where you can get into that flow state. If all you do all day is nothing and you sit around and think about your symptoms, and that's just going to keep it festering in your mind. You need to do something with your time that gets you focused on what you're doing so that you're not focusing internally on your internal dialogue so that you can shut off that default mode interference, okay? So that's number 1, working on mindset and mood, reducing stress, anxiety. So these are things: exercise, sleep, diet, mindfulness, CBT, socialization, relationships, finding a purpose, positive thinking, etc. Okay? And you're going to see a little bit of a trend here. Number 2, reduce inflammation and improve metabolic health. Okay? Reducing inflammation usually comes down to diet, sleep, regular exercise, and reducing stress. So all of the same things I talked about in number 1 are also working to reduce inflammation and improve your overall metabolic health. Number 3, get reconditioned gradually. Okay, it's going to take time. A lot of patients will say, I used to be able to do X, so I'm just going to go and do X. It doesn't work that way, because if you've been sitting back here doing nothing for 6 months and you try to go and do what you used to do or what you think you should be able to do, you are going to have a tough go of it, okay? So it takes time to build this up. So you have to start very, 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 very small, okay? After COVID is over and I'm allowed to go back to the gym again, I don't even want to know what my bench press is going to be. I don't even want to know what I'm going to be able to squat, because I've been doing body weight type stuff, but it's not the same as actually loading up a bar and doing the work. So I know that I can't just go back in and be like, well, I used to do this and I'm just going to load it up. I'm going to hurt myself. And it's the same thing with concussion patients, okay? If you used to do all of these things, you used to be a multitasker, that's great. But don't try to do all that now. Okay, sit back and just get focused on doing one thing, right? I'm going to work for half an hour. That's it. Then I'm going to take a break. Then I'm going to work for another half an hour. Then I'm going to take a break. Start small, build up from there, okay? Take breaks as needed. Learn where your line is and challenge it every week. You have to challenge it. Sitting back here in the comfort zone is never going to help you. Yes, you may be comfortable right now, but guess what? You're never getting beyond that. You're never going to get back to where you were if you're going to sit back here and wait for somebody to come along and fix you. It's not how it works. You have to fix you. That's the only way, okay? Be mindful of fear avoidant behavior, okay? It keeps the problem around. Anything you do to, what you resist persists. That's kind of a bit of a saying. So you have to go out and do things in order to, push that boundary. So anything you're avoiding, it will just get worse over time. So be very mindful of that. Work with a cognitive behavioral therapist or some sort of mental health professional to help you get over that fear avoidant behavior, because it is actually killing you slowly. And then finally, number 4, work on reducing your physical symptoms. Like I said, things like dizziness, headaches, all of these things keep you in this fight or flight mode, which is going to contribute to fatigue. You can only be dizzy for so long, okay? But don't start there, right? Start with building the foundation. So our concussion recovery pyramid, the bottom rung, the foundation, is mindset, nervous system hyperarousal, how to deal with setbacks, how to deal with stress and how to reduce stress. The second rung is inflammation, gut health, sleep, hormone regulation, blood flow, which is exercise, diet, and nutrition, okay? Then finally, at the very tip is now you getting into rehab. So you have to build that foundation for it to have an effective outcome. So if you've been working on vestibular rehab and it's not getting better, and if you've been doing this and that and it's not getting better, chances are you haven't built your proper foundation. So I think that's the important thing here. So like anything with concussion, what is going to reduce your fatigue? It's taking this comprehensive approach. It's treating the whole person and not just the main symptom of fatigue, right? If you're going to go to a doctor, they're going to give you some sort of medication for the fatigue specifically. But guess what? That's going to come with a million side effects that are going to cause increased dizziness and all hyperarousal and all these crazy jittery things. And so you want to be very careful. Medication is an option, but I wouldn't do that first. I would build my pyramid first, and then if at the end you are still having issues, then I would maybe look the medication route, but definitely not the first line of defense.